So joining me today is none other than Dr. Aidan Schlome. Hello to you, sir.
Hello, how are you doing today?
I am absolutely incredible today. I am very happy to be chatting to you because I love to learn more about my teeth, about my smile, and how to take care of it. So thank you so much for joining us today.
Thank you for having me today. It's a great privilege.
All right, so you are currently based at Evander District Hospital in Mpumalanga, right? Tell us more about that and about yourself.
Yes, so I am currently doing my community service. I graduated last year with distinction. And basically, I aim to further my knowledge and skills in the field of dentistry and more specifically in oral pathology, as that's something that I feel very strongly about. And I really just hope to empower more students. That was something that was very big for me at university, was to try and help other fellow students. And just to further my knowledge in dentistry and to be an ambassador for good oral health.
And that is exactly what you are doing today, which means that you're already well on your way to all of your goals, which I absolutely love. So chatting about oral health today and also about a happy mouth is a happy mind. So how does oral health connect to overall health, including conditions like heart disease and diabetes?
Okay, so basically our mouth is not just an isolated part of the body. So I think that's a very big misconception, is people find the mouth is very isolated, but in fact it's not. And basically the idea that a happy mouth is a happy mind really underscores this interconnectedness. So when we speak about oral health, we're not just speaking about the bright smiles and the healthy gums. We're really discussing a fundamental component of overall health. So from research that has been done in the dental and medical field, we have seen that chronic inflammation in the mouth, such as that caused by periodontal or in layman's terms gum disease, can actually lead to inflammation in other parts of the body. So bacteria from these inflamed gums and these infected gums can actually enter the bloodstream when we brush our teeth, for example, and this can actually go and form little plaques in the arteries, which is actually a risk factor for heart disease. And there are, as I said, several studies which have shown this connectedness, so it's not just a theoretical concept. And then similarly, in diabetes, what we see is there's a bidirectional relationship between gum disease and diabetes. So people with diabetes are often more susceptible to infections in general, including those of the gums. And basically what happens is it can also actually make managing sugar levels much more challenging. So basically, in general, this creates a cycle where a healthy mouth supports better diabetes control, and effective management of diabetes can also help maintain these healthy gums.
Wow, I had no idea. Yeah, I had no idea that your mouth can actually show you the heart disease and diabetes and have a connection. I had no idea about that.
Exactly. And then more than that, it also affects our mental health. So if we're experiencing any dental pain or discomfort, it can lead to stress and anxiety and affect your overall mood. And really, we just need to maintain our oral hygiene and make sure we're caring for our mouths in order to live a happy life and have a happy mouth and a happy mind.
Exactly. I completely agree with you there, especially with that tooth pain. I mean, it's one of the worst pains that I ever have received.
Exactly. It really can be debilitating, that tooth pain.
Yeah, it totally can. I mean, when I had one, it felt like my tooth was sore, it felt like my whole mouth was sore, and then it moved up to my cheek, and then it moved into my head, so it was basically like an entire face pain caused by one small little tooth.
Exactly, and that also shows the interconnectedness, because all the nerves in the head and neck are so connected, and all these pathways, so it really can cause more than just mouth issues.
Right. So, you know what? Sometimes we actually just go to the dentist, right? When we have the pain or when we see visible issues. But how often should we actually visit the dentist?
So the thing is, what we need to really be big on in healthcare is moving towards preventive care. So preventive care is really the heart of maintaining a happy mouth and obviously therefore a happy mind. So even if you're not experiencing any pain or any visible problems, regular visits are definitely crucial, and we as dentists do suggest at least twice a year, because often these issues develop quite silently. And basically, if someone visits the dentist twice a year, we spot these early signs of trouble, whether it's gum disease, whether it's small cavities, or even other changes that might indicate other systemic health conditions. So when we do check up during these, frequent appointments, such as twice a year, we're not only looking at your teeth, we're looking at your gums, we're looking at your tongue, we're looking at your overall oral cavity. And basically, we're therefore able to catch the diseases early, treat them more easily, and that also benefits yourselves, because then you are spending less time at the dentist and less money, because if you prevent, you're not having to pay for the curative treatment.
All right.
And also, we also provide opportunity for personalized advice during these appointments. So we'll show you how to brush your teeth, how to floss your teeth, how to be proactive, how to feel confident. And basically, if you're confident, that always leads to a happy mind. So, that's basically how often you should visit the dentist.
Alrighty, quite a lot being spoken about on the dentist chair there, hey?
Yeah.
And so we've got a question here from a loyal Clicks customer, and they are asking a question, asking, why am I having severe multiple teeth pain and headaches after having a dental clean nearly 2 weeks ago, and how long is it supposed to last? Also, what is the correlation between the headaches and the teeth pain? Dr. Schlome?
Okay, so that is obviously a question that you would have to go and see the dentist about. But from my knowledge, what I would say is that from a dental clean, it shouldn't be too painful. However, if you are experiencing sinus conditions, that can also lead to headaches. So obviously, your teeth are in very close proximity to your sinus. And if you are experiencing this constant pain on a lot of the teeth at the top, that could be indicative of a sinus infection or something sinus related. So it may be more than just from the dental clean necessarily. It could be something else.
All right. So you are definitely suggesting they go back to the dentist as well.
Yes, I would suggest the dentist or even a medical doctor just to check if there's no sinus related.
Sinus related. Yeah, sinus can be an issue. I have that. It's very bad. And I've also had a toothache before, and let me tell you, it is bad. All right. So thank you so much so far for all of the information that you've imparted on us. So does oral health only refer to the condition of the teeth or the mouth in general?
So oral health is much more comprehensive than just the state of your teeth. So it encompasses the entire mouth, so your gums, your tongue, even the inner linings of your cheeks, the roof of your mouth, the floor of your mouth, salivary glands, and even your jawbone, because the teeth are sitting in the bone. So all of these elements basically work together to ensure that your mouth functions optimally. So it obviously affects the way you speak, chew, and even your taste, okay? So a holistic approach reinforces the idea that a happy mouth is a happy mind, because every part of this oral ecosystem plays a major role in the overall health and quality of life. So, for instance, healthy gums are essential not only for supporting your teeth, but protecting against infections. Like I spoke about, your gums are rich in blood vessels, and it can actually spread these bacteria all throughout your body. Also, saliva is another component of oral health that's very important, because saliva has many functions, and basically it helps break down food. It also protects against bacteria, neutralizes acids, and therefore it also protects against your teeth. And then another very important aspect, which I feel very strongly about oral health, is oral cancers and the prevention thereof. So diseases or viruses, more specifically, such as human papillomavirus or smoking, can be very major causes of oral cancer. And this HPV virus is common in the mouth and has been linked to the development of oropharyngeal cancers. So therefore, regular dental visits and oral cancer screenings are very essential in order to pick up these changes in the oral tissues, and therefore to help prevent the progression and also to treat these cancers very early on. So therefore, you can see it's way more than just, looking at the teeth in the mouth and seeing there's no issues. It's more comprehensive, way more all-encompassing in order to, be happy, have a happy mouth and a happy mind.
Wow, thank you so much, Dr. Schlome. So, how can people actually protect against these diseases that you described above?
Okay, so the first big thing, so the general diseases that we see is obviously dental decay, and gum disease. So for that, daily oral care helps a lot. So if you brush your teeth twice a day with fluoride toothpaste, you floss, sometimes the mouthwash, and basically what we're doing here is we're trying to remove that plaque and remove that bacteria that cause the gum disease and cavities, and also to reduce inflammation in general. Then another important aspect is healthy diet. So if you limit the amount of sugary foods, also limit the amount of acidic foods, that can definitely help with tooth decay. And also if we eat a lot more vitamins and minerals, that can support your gums. And just eating healthily. And then also the regular dental visits, which we discussed extensively. Also lifestyle choices. So to avoid tobacco products, avoid products that contain high alcohol levels, because those are two things that have been linked to oral cancer development. Also to educate everyone. So if everyone's educated about oral health, obviously it's going to help people protect against these diseases and help maintain a happy mouth and a happy mind. And then lastly, which I feel strongly about again, is with the prevention of oral cancer and oropharyngeal cancer. So obviously to try quit smoking, alcohol consumption, and then also the human papillomavirus or the HPV vaccine is a very powerful tool in reducing oropharyngeal cancers. So if you are eligible for that vaccine, you should make contact with your health care provider. Also practicing safe behaviors, such as reducing the number of sexual partners and using protection, will also decrease the risk of HPV transmission. And basically all these strategies are going to help to keep your mouth healthy, to keep your body healthy in general, and if you are happy in your mouth and in your body, you are definitely going to have a happy mind.
Now, Dr. Schlome, sometimes when one brushes their teeth, they do have some, the gums start to bleed ever so slightly, but sometimes the dentist says, no, don't stop brushing your teeth just because it's bleeding. So how do we know when the right time is to actually go to a dentist to find out, hey, is there something going on? Is there inflammation happening, etc., etc.? So how do we know when to actually visit the dentist?
So if you haven't been a regular flosser or brusher, then obviously the first time or first few times it is going to bleed, because your gums are still going to get used to that.
Yeah.
If you constantly can see that your gums are bleeding, and if you can see that there's calculus buildup, which is that plaque that has become hard and calcified, if you can see that build up, then you should definitely be visiting your dentist, because that's what's causing the inflammation in your gum. So we professionally have to remove that calculus, because it's not going to be removed with just a normal toothbrush and toothpaste. So we need to remove it so that your gum can actually heal, and therefore there will be less inflammation and less bleeding.
All right, so what I need to do right now is make an appointment with my dentist. Thank you so much. But you know what, Dr. Schlome? Unfortunately, there are so many underprivileged communities that don't actually have access to a proper oral health care, right? So what are you guys doing in terms of oral health practitioners in improving oral health and providing services to underprivileged communities?
So that's a very good question. So I think this starts right at the beginning of dental school. So right from first year, we are doing community outreach programs where we go and we visit underprivileged schools. We even do little shows or little skits for the young students so that they understand it at a very basic level. And because, like I said, prevention is key to everything. So we go into the schools. Also, there are mobile dental clinics which we go and we visit, community outreach programs. Also, another very big project which is being rolled out in South Africa currently is the Transnet Pello Pepper Healthcare Train. So this is a train that moves to different locations throughout the country that provides healthcare, wellness checks, dentistry, psychology. So basically last year I had the privilege of visiting Ulundi in KZN for 2 weeks, and it was very rewarding to see all these people coming for dental care. They wait in the queues from early in the morning just to be able to be seen because of the lack of resources in the community.
Oh, that's fantastic. Thank you so much for all the hard work.
Yeah, no, it's a pleasure.
So, Dr. Schlome, listen, I cannot bid farewell for you today unless I know your daily oral health care routine. Like, from a dentist point of view, what is your daily oral health care routine? What does it look like?
Okay, so I like that one. So it's good that people learn from my routines.
Yes.
So basically, when I wake up in the morning, I brush my teeth before I eat breakfast. So the reason for that is because the reason for that being is if you eat and then brush your teeth straight away, your mouth may be very acidic if you've had like a lot of carbohydrates, and then you're basically brushing away the enamel of your teeth.
Okay.
Yeah, so obviously use a fluoridated toothpaste because fluoride has been shown to protect against cavities and to strengthen your teeth. And then, again, obviously at night, I floss my teeth, okay? So I floss them with just normal dental floss.
Right.
And I also floss before I brush my teeth.
Oh.
Again, you want to basically loosen the debris and those germs that are sitting in between your teeth before you brush them, so that you're actually brushing those germs away.
Oh.
Basically, after you brush your teeth, then you must not have anything to eat or drink until the next morning. And the crucial thing is that people often don't understand is that nighttime brushing is actually so essential, because at night what happens is you have less saliva in your mouth, and saliva is what protects against the cavities and the decay and gum disease. And basically if we haven't brushed our teeth at night, then all those germs from the whole day are going to be sitting in your mouth, and you're going to sleep with that, and that is a big risk factor for an increase in decay, gum disease, etc.
Oh, so that's why we need to brush twice a day. Do you do any rinsing with mouthwash at all?
So every now and then, if I feel the need to, I do, like if I just want to, just to get that fresh breath sensation. But other than that, not particularly. It's just personal preference.
Right. Wow. I am actually very surprised at your routine, Dr. Schlome, I must say, because I always brush my teeth after breakfast because I'm thinking, let's just take away all of the food that I just ate. You know what I'm saying? So
exactly. Yeah.
Wow. I had no idea. And then with regards to flossing, most people floss after they brush their teeth.
Yeah.
Yeah.
The trend, so hopefully I'm changing some trends.
Absolutely. You're coming with groundbreaking stuff here. Thank you so much for your daily oral health care routine. I think I'll follow it, and I'll let you know. Maybe when we chat again, I'll let you know how I'm doing with your oral health care routine. Thank you so much for all of the knowledge that you've imparted today. I do appreciate your time.
Thank you so much for having me.
Oh, thank you so much. Enjoy the rest of your day.
Thank you. You too.
Absolutely brilliant stuff indeed. That was Dr. Aidan Schlome from Evander District Hospital in Mpumalanga. Just brilliant to chat to someone so knowledgeable about everything with regards to oral health care, and also about this great day that we are celebrating tomorrow, the 20th of March, which is World Oral Health Day. So I hope you're ready. I hope you've got your toothpaste ready as well. And this oral health interview is proudly brought to you by SADA. SADA's vision is to be recognized as the trusted leader and voice of oral health care in Southern Africa. Their mission is to promote the interests and serve the needs of their members, and above all, encourage optimal oral health care for all South Africans. Learn more about the South African Dental Association by visiting www.sada.co.za. Now, all the speakers during this week's Oral Health Awareness interviews are part of the Young Dentist Council Exco, and to learn more about the Young Dentist Council, you can visit sada.co.za. young-dentist-council-ydc. Absolutely brilliant to chat to such a knowledgeable dentist.